Hello and welcome to edneurorad.com. Today I'm going to be giving a short tutorial on how to use the anatomy modules. Currently there are 4 anatomy modules: the skull base and brain, neck CT, temporal bone, and cervical spine. This is the main module, which is the skull base and brain, but also includes detailed sinonasal anatomy annotations. When you first load an anatomy module, you're going to see a viewer that's identical to the viewer you use for the cases, with some new additional features. This particular module, the main module, has 2 volumes. One is a bone reconstruction of a CT, and the other is post-contrast T1 weighted images from a high-resolution MRI. These are from the same patient, and they are linked so that they basically match their anatomical plane, and you can scroll them together. Of course, the bone reconstruction is at a higher resolution, but otherwise, when you scroll them together, they're linked, and you can see corresponding anatomy between MRI and between CT. Now, for these anatomy modules, whenever you hover your mouse over one of the colored overlays, it gets highlighted, and also the name for that particular anatomic structure gets displayed on the bottom of the screen right here, as you saw. So here, this is the squamous temporal bone, mastoid temporal bone, and the lambdoid suture, and as you see, they get displayed in the bottom of the screen. Now, there's also this autocomplete text field here that you can use. You can use this to either filter what's displayed or search for one particular structure to see where it is. For filtering, you have different filters here, including brain, bone, sutures, foramina, or the sinonasal cavity. For instance, when you hit brain, it'll only show you the brain structures, as you can see here by default. Now, if you hover your mouse over a structure that has annotations, it'll still get highlighted, and it'll show you the name. Here it's showing you parietal bone, but it won't by default display that. You can also use this to search for a particular structure. Like, for instance, if you wanted to know where the foramen ovale is, you would type foramen ovale, and then you can click on it, and it will take you to foramen ovale on all your views. One thing to remember is that all the anatomy modules use high resolution volumes, so you can use the MPR tools to MPR through the different orientations, and that's actually pretty helpful, and because they're high resolution, they look very good. In particular, if you change the layout, the first time you change layout, it'll actually toggle through the volumes and the orientation. So if we change this to 2x3 layout, you can see it toggled the CT through the different orientations, and it toggled the MRI through different orientations. Now, there are a few additional tools in the top right corner of the viewer that I'll use the temporal bone anatomy module to show. One is this toggle anatomic label. This basically just toggles the visibility of those color overlays all together, and it has a keyboard shortcut of A, so you can hit the keyboard shortcut A and it will do the exact same thing. Second, there's this flip images left to right, which for these unilateral images is good because it'll flip it left to right, so you can see the correlative anatomy as if it were on the other side of the body. One unique feature of the neck CT anatomy module is that you can toggle what to display on the left side of the volumes. The right side of the volumes on the neck CT anatomy is the individual structures, so you have your individual muscles, blood vessels, etc. But the left side is either showing you the deep spaces, like it is by default here, the carotid space, posterior cervical space, and perivertebral space, but you can also toggle it to show the nodal stations instead. To do so, you will go under more options, and you will hit, instead of deep spaces, the nodal stations, and now you're showing you the nodal stations, nodal station 5B, 4, or 6. All anatomy modules have a quiz mode. To access quiz mode, you will go to this more options, and then you will hit quiz mode instead of normal mode. And once you hit quiz mode, it basically shows you one particular structure. Here it's this thing, and then asks you what that structure is. And if you hover over it, you won't see what the answer is, but if you click show answer, it'll tell you what that particular structure is. And then you can hit this to go to the next structure to get quizzed on. Now, quiz mode will only quiz you on the anatomic structures that are visible. So if you use a filter, for instance, sinonasal cavity here, it'll only quiz you on the sinonasal cavity. So if you go to quiz mode now, it'll only ask you about anatomic structures in the sinonasal cavity, like so. This viewer has a 3D surface reconstruction capabilities that you can access by clicking the 3D surface rendering button here. Here we did that on the bone reconstruction CT, so you get a 3D surface reconstruction of the skull, and then it also, for the anatomy modules, the color overlays get displayed on top of the 3D reconstructions, and it works essentially exactly the same way as it did for all the two-dimensional panels. So you hover your mouse over any particular colored structure, and it'll show you what that particular structure is on the bottom of the viewer. All these tools have sort of correlative effects on the 3D panel as well. The window tool, basically the center of the window setting, will determine what sort of what gets reconstructed. So this is just a threshold. So you put a lower threshold, basically soft tissues get reconstructed. You put a higher threshold, only bone gets to be reconstructed. You can move this thing around. You can zoom in and out, and then obviously you could rotate it around. There's also this cursor tool, and the cursor tool is nice. You click at any point, it'll put a cursor on there, and it will show that exact same cursor location on any other panel that you might have. So here we'll show you the corresponding anatomy in the 2D axial plane, which could be pretty nice for seeing the different anatomy in 3D versus 2D. A unique tool that's available to you on these 3D panels is the clip plane. When you click clip plane, it will use the plane defined by the 2D panel right next to the 3D panel as a clipping plane for that surface. So as you scroll this thing around, you can see in real time the effect of varying this plane on how you're clipping. So here you're clipping everything that's on the bottom of the panel plane of this particular panel, and you're seeing inside of the skull. If you change this thing to be in another orientation, obviously the orientation of your clip plane changes, and you basically will clip in the sagittal plane or coronal plane, etc. Now if you wanted to clip everything that's on top of the plane instead of on the bottom, you simply hit this reverse clip plane and it will reverse it to the other side. And now as you can see inside of the skull base. When you're done with your clip plane, you can either hit accept, or if you change your mind, hit cancel. Here we'll accept, and we get a view of the skull base. Now as you can see, this is a bone reconstructed, so it's pretty sharp and kind of looking a little bit grainy, and it's also a bone reconstruction from a CTA, so you see all these blood vessels overlying our structures. I've added a number of additional settings here. I won't belabor all of these. You can click on them and see the effect they have. But I've made a number of presets that I think are pretty useful for optimum reconstructions. So these presets, to access them, you go here to these more options, and then there are the presets here. You have the default preset, which is just what you do when you log into the website. You have the skull base 3D 1x2. You have a three-dimensional reconstruction of the skull base that I think looks reasonably nice, and you can use for correlating your two-dimensional anatomy with your three-dimensional anatomy. Skull base 3D 2x2 basically just adds the two additional bone reconstructions in the coronal and sagittal plane. So you have all of the planes. Probably this particular mode, it's best to just toggle full screen, so you have the full screen available to you to look at all these various panels. Then you have the brain 3D 1x2. This will do a brain reconstruction. Here it will only reconstruct the overlays, not the actual underlying brain MRI, and you can see the three-dimensional brain and correlative anatomy with the two-dimensional MRI. Similarly, brain 3D 2x2, you have the 3D and well as the actual brain MRI in axial, sagittal, and coronal plane. Finally, there is the sinonasal 1x3, which is a zoomed-in view of the sinonasal cavity, just because this CT has very good resolution, and the sinonasal anatomic annotations are also pretty high resolution, so you can see the high-resolution sinonasal anatomies if you wanted to. Note that the detailed anatomy is only annotated on the right side, so you can use this flip images left to right to flip the image, and it will look like it's annotated now on the left side, in case that would be of interest to you.